Welcome to the Myofascial Health Podcast, hosted by me, Unu. Follow along as I explore the depths of John Barnes' myofascial release approach on my road to mastery. Along the way, I'll be sharing the lessons I learn as I open my myofascial release practice in Austin, Texas, so that you don't have to make the same mistakes I do. Welcome back to the Myofascial Health Podcast. Now, I'm joined here by a very special guest. She's been a physical therapist for 26 years. She has a bachelor's in health education. She has her own PT practice since 1999, and she learned about myofascial release in 2000. It's my honor to introduce Sepi Aeen. Thank you so much for joining me on this podcast.
Thank you, Anu. Thank you for having me. It's my pleasure.
Now, something that you had mentioned briefly right before we started is you've been a PT for 26 years, but you've actually been working in the industry for 36 years. And you talked about how you were a PT aide since the age of 17, which is how you got introduced into this career. Can you talk me through how you got inspired to become a physical therapist?
Oh, absolutely. I'll be happy to share that. It's a little bit of a long story, I'll tell you. When I was 17 years old and I was still in high school, I was offered a job after school and on weekends at a physician's office where they did physical therapy. And back then I didn't know about the physician-owned PT practices. So I started working not knowing much about physical therapy or anything. Then I went into college after graduating high school, still not knowing what I wanted to do. I started out as a math major. Then I wanted to become maybe a teacher, a psychologist. I had interest in many different areas. And after that practice, I started working at the hospital and was exposed to many different departments and disciplines within PT. And I was blessed enough to work with many skilled physical therapists. So I got to see a lot of, med-surg patients and pediatrics, orthopedics, neurology, wound care, all kinds of different disciplines in physical therapy, and never really still knew that I wanted to become a PT. So when I did some soul searching, I wanted to find out what is it I really want to do. You know how it is when you're in college, you don't really know what you want to do with the rest of your life. So I knew that I loved teaching. I knew I loved the human mind and psychology. And I also loved science because my father was a dentist. My uncle was a physician. My mother was an educator. She was a teacher and a school principal. So I looked within and I realized, wow, what I'm doing in the physical therapy settings, it's dealing with the people's physicality. You're dealing with people's minds and emotions, and you're also educating them. And that's when I started to change majors and I looked into becoming a PT. So I applied, and with all the hours of work that I had, under my belt as an aide, I got in the very first year. I wasn't sure if I would, but I got accepted the first year and became a PT. I got my bachelor's. Back then, all the schools were still bachelor's level programs. And later on, we became a master's program. I continued on to do that. And several years ago, I completed my doctorate degree as well.
Congratulations. I'm at a place in life where I've done the schooling and I don't see what would drive me to do it anymore. So to hear that you had gotten a bachelor's to a master's and ultimately got your DPT or doctorate is very inspiring. Now, on that note, I guess when I had heard you speak about it, I thought you had known that you wanted to be a PT since you were 17, but it sounds like that was just something that was part of your path until you had to make that decision. And you talked about a soul searching experience. Can you unpack that? Because I think there's a lot of, especially students who are in undergrad, who might be going to school without knowing what it is exactly what they want to do. And I think that can be a very challenging transition in life because oftentimes, at least for me, there was an expectation that I went to college. Now, as you get towards your junior and senior years, it's like, okay, this is about to end. What's that next chapter? Can you share with the audience how you came upon that decision for yourself?
Well, I think the first couple of years of college, you're really meant to be confused. Some people know from a very early age what they want to do. Some people come into this world just knowing since childhood. But most of us are searching and trying to figure out what it is we need to do or want to do. So the first couple of years of college, I feel you're supposed to search and explore and, test the waters in different areas and see where your passion lies. I think the bottom line is if you do something that you're truly passionate about, you do it from the heart, you just do it with every cell in your body, that's where you find your true happiness and your purpose. So for everyone, it's different. And for me, it was, like I said, all those different components, being able to teach and being able to help and being able to, reach people's minds and emotions. That's where I found my passion. And then later, of course, I discovered John's work, which was really what my calling was. And I'm sure we'll get to that. But finding where your passion is. And if you love what you do, then it never feels like work.
I could only agree with that. I'll say that since I started my own practice and I'm a physical therapist who does myofascial release, I enjoy Mondays. And it's rare for me to come across individuals who share that same passion. Now, on that note, just like you mentioned, then you found myofascial release, which you described as your calling. How did you come upon myofascial release?
So, when I was seeing patients as an aide, I realized very early on that there was something wrong with our Western medical model. And I sort of blamed myself for not having the knowledge base. So, that's when I decided to pursue the educational component of it. So, I did the bachelor's, I got the master's, I became a P. I got my license. But unfortunately, even after all of that, when I still was treating patients in the clinical setting, I realized that I was only able to take patients so far, and there was something missing. And patients loved me. They appreciated what I did for them. They knew I was doing my best, but they just weren't getting the results that they were hoping for or that I was hoping for or counting on. That's when I realized in 99, when I got my master's, that I need to open my own practice because I can't follow these rules of, oh, you need to see this many patients and you need to worry about productivity and insurance filling and all of that. So I figured if I had my own practice, I would have better control over what I needed to offer to my patients. Well, that helped a little bit. And then in 2000, I think John came to Pasadena. All along, I would get his brochures in the mail. I would look at his picture on the brochure, those big, beautiful, piercing blue eyes, and there was just something connecting us. And I'm like, I have got to meet this person. There's just something about him that is very intriguing, very familiar to me. And I would like to meet him, but I was broke. I didn't have any money, and all his seminars were usually out of state. And I just couldn't afford to do it. So my research partner from my master's research thesis partner called me up one day and said, John is coming to Pasadena, which is, in LA. And he hates LA. He never comes to LA. And if we get a group of us together, we can save a little bit on the tuition. I think it was like $100 or something. And Pasadena was very close to Studio City, where my practice was at the time. And so for me, that was a no-brainer. I signed up for the seminar. I went to his first seminar, and John probably talked for 5-10 minutes explaining all the challenges that I was faced with in the clinical setting. And it was just a knowing. He spoke to my heart, and I connected with his principles and his, philosophy right away. And at break time, I went up to the back and said, okay, where do I sign up for the rest of the classes? I gave my credit card and I said, I don't care. I don't care where it is, how much it is, and what I have to do. And that was the start of my journey, because he said exactly every single thing that I was facing in the clinical setting with the patients. Like, I was limited. I couldn't take them so far. We were blaming patients for not getting better, and we never took responsibility as the profession. And so that's how I got started in 2000. And I'm very blessed because it was very early in my professional career as a PT, and it was right when I started my practice, and the rest is history.
I love that. And, I think a lot of times we're going to come to these crossroads in life, and there's a loving way of going about it and a fearful way of going about it. John refers to this as channel 5 and channel 3. Channel 3 being loving, channel 5 being more fearful. And I know that in the beginning, yes, the seminars are expensive, especially if it's out of state. Not only are you paying for the seminar, but you have to find room and housing and then a car to rent, and those expenses add up. Now, I will say that now today, it is comforting to have developed my own practice to where I only have to see a few patients and say, hey, I can afford a seminar. How were you able to work through that fearful voice that was saying, it is really expensive? Like, we don't know what this is exactly. He's saying stuff. But for you to have that conviction of saying, hey, here's my credit card information, and I will sign up for the rest of the courses no matter what, I will find a way. What was that switch for you?
Like I said, when John spoke about his work and how he stumbled upon it and what he had to offer, for me, it was really a no brainer. I was connecting with it because of all the years I had been in practice. I had been in so many different areas of it, and I kept seeing the same downfalls and the same problems where we were not offering the best to our patients. And so for me, really, it was like I said, a knowing. It was not something that I had to think about. And I thought of it as an investment in my profession, in my patients, in my practice, and in myself. So I literally, for that first year, I was going to Sedona several times a month sometimes, and I took all of John's classes. I repeated all of them, then started assisting with the seminars. And now since 2000, I think 17 or 18, I've been blessed enough and privileged enough to be one of the full instructors to teach MFR1 DVD course and the full pelvis course. So really for me, it was a knowing. I just knew.
Okay, and so I hear you, and I just know that there's a period of life where I wasn't as connected to what I consider the spirit, and this idea of like you just know when you know. I didn't know what that felt like. Were you always in tune with that, or did you have to kind of like convince yourself?
Well, now that I'm in my early 50s, I know with a lot more certainty, looking back at my younger years, I remember being 17, 18 and working on patients. And the one thing patients always told me was, Sepi, you have a gift. And oh, did I dismiss that for years, decades, because I didn't believe that I had a gift. I just thought people were being nice to me, people appreciated me, and I really didn't think about that. But now, in a very humble way, I have learned that, yeah, perhaps there is a gift that patients are connecting with, and not to be arrogant about it, but it's the love that comes through me that patients are feeling. And I'm fortunate and blessed to be one of the gifted ones. But I think, yeah, as we get older and as we learn through our experience, we connect more with our abilities, our intuition, our purpose in life. But when we're younger, no, we do struggle. But with signing up for John's seminars, back then I knew. And I think I come from a background where maybe being more intuitively connected, I've had that since childhood from my dad, from some of my life experiences. So I may not have known about it, but in certain places in life where you just know, I was probably listening to that intuition.
I love that. Now, was the first course Myofascial Release 1 course, or was it something else?
Yeah, I think it was the Myofascial Release 1 course, or if I'm not mistaken, it might have been the full pelvis course. It's been so many years, 25 years, but it was one of those two. And then I signed up for the series. So it might have been full pelvis that John taught in Pasadena, but don't quote me on this. It could have
Yeah.
been the other way around. But then I signed up for 3 seminars. So I closed my practice, I took time off, and I went to Sedona for 3 courses because I was just sold on it.
Okay, I think that that is a huge risk, to trust this knowing so much that you're saying, "Hey, this I think is what I've been looking for." Actually, I'm confident, this deeper knowing of which I'm willing to close the doors to my practice to learn about this. Like being on the other side and opening up my own practice, I can see that now. But I know that earlier on in my career, at least, that was such a huge leap. And I think all of us have had some version of this. How are you able to do that? Because for me, I would imagine there's a lot of insecurity for myself and not knowing the end result of what it could be. And then usually that fearful voice is louder in saying, what are you doing? Like, how could you possibly do this? To the softer, intuitive voice, which is guiding you saying, this is going to be the thing that changes who you are, the way you practice, the way you serve others, and it's going to be worth it. How do you navigate that, or did you not even have that fearful voice at the time?
I didn't have that fearful voice at all at that time. It was just like when I decided to open my practice. One day I said, you know what? I'm tired of being told what to do by my employers, and I need to be in charge of that because I know what my patients need. And so it was a knowing. I said, this is what I'm going to do. I took my last paycheck. I borrowed a little bit of money from my oldest sister and I opened up my practice. I started doing home health to supplement my income. And then it just took off because I knew that's what I had to do. And with John's work, I knew that was the missing link in the outpatient clinic that I was working in, the outpatient setting where you see patients who are in pain and who are dealing with either acute or chronic pain or are dealing with orthopedic, musculoskeletal, post-surgical rehab. In that area, I think we were missing John's work. In other disciplines in PT, I know we do incredible work for people in, traumatic brain injury things and neuro. And I'm not trying to put down our profession because I think we do some amazing work in our profession. But with the pain management and outpatient settings, there was always something missing. And for me, I just knew I had to pursue this, and I'm glad I was wrong. It proved me wrong. It didn't disappoint me. And yeah, I didn't have the fear. Maybe that's what it was. I didn't have any fear.
And maybe you're just really in tune with your own intuition because oftentimes your intuition will guide you towards your greater purpose. Whereas for me, I'm not as familiar and it's gotten a lot better. But oftentimes, when I feel compelled to go in a certain direction, I will have this logical and rational voice that will try to talk me out of it because a lot of times it doesn't make sense on paper. And so, if you can just quiet that voice and do the courageous thing, even if it doesn't make sense, oftentimes it'll work out better than you could have imagined. At least that's the way that it's played out in my life.
Yeah, and a good question to ask is what's the worst thing that can happen? We ask our patients that, right? And John has taught us to ask that. So at that time, I thought, okay, what's the worst thing that can happen? Yes, I'm investing this money, I'm putting all this time and, effort into learning something new, but it won't be the end of the world, right? If it doesn't work out. But I knew it was going to work out.
That's awesome. See, I love that. And I'll just say that even if you're not like Sefi, maybe you're a little bit more like me, where you're not as intuitive, be skeptical. Something that I really appreciated, John, at least for my seminars, is I was super skeptical because when I had seen him work on someone on stage, I'm like, what is going on here? There's no way that this has been existing for decades. And I'm only seeing it for the first time right now. And I would ask a ton of questions because this logical Channel 5 side of me was like, none of this makes sense. It goes really hard against the grain, but there are experiences that I not only saw, but more importantly, felt that I couldn't deny. And that is that intuition. It's trusting what you feel. So if you're more intuitive like Sepi or you're more skeptical like me, just keep moving forward, As long as you don't quit, it will always work out. I think it's when you stop that then you kind of silence that intuition and then you kind of let your environment dictate who you are. Now, I think what I love hearing about your story is you noticed the limitations within our profession. And again, we're not bagging on our profession. We love physical therapy, but there are certain things that keep your hands tied due to the nature of healthcare in general. What did you see that you really knew wasn't right that when you started your own practice, you were able to change?
Well, for one, the medical model and insurance companies, that was one thing I noticed. We were following the regulations of what the insurance companies wanted us to do. So there was always this pressure of, oh, you have to bill for so many units and you have to have productivity. And so you couldn't really spend the time you wanted with your patients. And in most, traditional PT practices, you have multiple patients at the same time and they're really not getting skilled intervention. They're putting them on either some piece of equipment or they're using heat or having some ultrasound done or, maybe some exercises done. And the actual time with the skilled practitioner is very minimal, maybe 10 minutes at best. So the model was, let's see how we can bill the most and get the most money and spend the least amount of time with our patients. As a result, patients weren't really getting better because they weren't receiving skilled intervention. And so then we had to document that, oh, patients were not compliant and patients were not following up with their home exercise program. And I didn't like that. I didn't like that we were not doing what we were trained to do as much as we should have done. And then we're turning around and blaming it on the patient. And so those were some of the things I noticed. And I decided that when I opened my practice, I would not even take insurance. So in the beginning, I did for a little bit because there was a little bit of that fear factor. I wanted to please the patients and, okay, sure, I'll do that. But shortly after, I stopped taking all insurances. The only insurance I'm still a provider for is Medicare, because I feel the older population, they all need our services so much, and not many of them can afford to pay our fees out of pocket. So I am still a provider for Medicare, but no other insurance companies. And what other limitations? Just not allowing us. Oh, and the other limitation mostly was we never treated the whole person. We were cutting up people into body parts, diagnoses, a certain joint, a certain, specialty, and that whole mind body approach was never, taught to us or ingrained in our minds, or even practiced anywhere in most of the places I got to work.
I
So,
completely agree. And something that John will mention is, in physical therapy school on the first day, they talk about physical therapy being an art and a science. And outside of that first day, they never talk about it being an art anymore. But I
mm,
think how you've described your gift is that ability to connect with somebody is part of the artistry, right? And something that we don't really follow are protocols. We don't say, hey, this is a shoulder injury that you're going to do these rotator cuff exercises and yada, yada, yada. I feel like those don't really work. And I completely resonate with your story. I always felt like I didn't know enough in terms of if a patient didn't get better, I would always feel really bad writing a note that said, patient was unresponsive to physical therapy, and I thought to myself, is it really that they're unresponsive, or is it because I don't know enough to help them based on where I was at in my career at the time? And so when I finally came upon John's work, he does a wonderful job of tying together the mind body connection to a way that is felt, not just spoken about. And I think that's a huge difference between myofascial release and, let's say, other education seminars, is there's a felt experience that until you feel it, you're just going to talk yourself around in circles. It's just kind of like riding a bike, like you can read how to ride a bike, but until you're on there trying to balance, trying to steer, pedal, and look across the street, like you're never going to know.
that's right.
And I think something that your experience has touched on is this limitation with healthcare in regards to the insurance companies. There are certain things that we follow to get reimbursed through insurance. And when I was just a student getting observation hours to apply to PT school, I remember the physical therapist complaining about how the reimbursement rates for insurance were going down. And I'll say, until today, and that was decades ago, those complaints are still there. So I don't think there's ever going to be a situation where all of a sudden the PT is going to say, hey, they're increasing our reimbursement rates. It's always getting cut. Now, with that, what ends up happening is because insurance is cutting the reimbursement rates, then to have a successful insurance-based clinic, you have to see multiple patients in an hour, and that's just part of just keeping the lights on, keeping people paid, and that's just the nature of the business at this point.
Yes.
And what that leads to, at least in my experience, was burnout, because now you're seeing multiple patients an hour. Now you can't just spend time working with patients, but you spend a lot of time documenting on how you worked with the patients. And that takes away from patient care. And I actually just took up a student on clinical rotation for the first time. And she was sharing with me that some of her colleagues are being pressured to bill 5 units in an hour. And I'll just say, for those of us who are maybe unfamiliar with insurance, just know that a unit is usually 15 minutes. And so in an hour, you could bill 4, and to get that extra 5, you're kind of doing something that I would consider as ethical because you're shortchanging the session to get an extra unit, right? Now, again, this is all based on the pressure that the insurance company puts on the PT clinics and healthcare providers. Now, those of us who have been fortunate enough to learn about John's work, and honestly, I think it's also that you have a servant's heart, this ability to connect, to really do what you feel like is best for the patient. I feel like we all have that. And then we go into certain situations that kind of make us lose that because of the nature of the business, productivity standards. And then we find something like myofascial release where we can say, hey, if you still have that desire in your heart, where you're really just being compassionate, you're really wanting to be present with the patient so that you can help them, you'd be surprised at how many people are responsive to that. And then you have the opportunity, if you choose, to start your own practice. And so I love that you shared that story. I can resonate with so much of that. What advice would you give to someone who was feeling burnt out? Let's say they were passionate, they got into PT school, you're learning about it. But then when you transition to actually working as a PT, it doesn't match that idea that you had in your head that sparked your desire to become one. What would you say to that person?
Well, I would say, without awareness, there's no choice. Find out where does the burnout come from? Is it the setting you're in? Is it the fact that you're dealing with insurances? Is it the patient population? Like, identify what the problems are, identify where the source of the problem is, and then see what steps you can take to separate yourself from that. Or what another beautiful way to say it is, what would the ideal work setting for you be like? What do you need to have in your ideal work setting to feel happy, to feel passionate, to feel satisfied? And then how can you create that? Because we fall into these patterns of, well, I'm getting a paycheck, I have to, pay my bills. And, life is very hard these days, fast paced, and everybody's got responsibilities. But sometimes when I decided to do it, I took my last paycheck, I borrowed some money, and I said, I'm going to make it work. I'm going to do home health to supplement my income, like I said earlier. So find out, what is it you need to do if you are feeling burnout, if you're not happy where you are, to find that inner passion. Because again, if you're happy and passionate about what you do, it's not going to feel like work.
You got it. Now, I love that you just simplify it. You're just like, yo, if this is the thing you want, go after it. And I also love that you're thoughtful about the end result that you want. You're saying, hey, well, figure out what's going to make you happy. What's going to allow you to feel these things, to be passionate, to do these things, and then work backwards, as opposed to just finding yourself in a setting where you don't think about those things, and then you just absorb everybody else's ideas and things about that, like, oh, no one's going to pay more than their copay for physical therapy, or hey, I've been working here for 15, 20 years. If you're going to be a PT, this is what it looks like. And when you're kind of caught in that environment, you can't
Mhm.
help but just to think like everybody else. And so I love that myofascial release, at least when I took my first seminars, it challenged that notion. And then I had to meet that desire there and say, okay, what is it that I want? And if this is part of that, then how do I work it in? Right. I think you explain yourself in a way that's like, hey, this is what I wanted to do. And so I work towards it versus like, oh, I'm just gonna wander around and hopefully this thing kind of hits me. It's like, no, it takes some effort, it takes some energy, and then once you put things in motion, that's where the path unfolds for you. Now, myofascial release has helped me with not just my physical therapy side of my life or my career, but it's also helped me with a lot of personal things. And so you touched on different things like, what's the worst thing that could happen? Or without awareness, there's no choice. What are other Johnisms have you worked into your life that have had a profound influence on it?
Well, I think one of the big ones or main ones that really doesn't just apply to patient care and in the clinical setting, but in life, is not attaching yourself to any outcomes and surrendering. Because how many times do we go through life fighting and struggling and wanting a certain thing, and not being able to surrender and soften and see what else may be out there for us. So I think detaching from outcomes has been very helpful for me in life. I do that in the practical setting and I do it in life as much as possible. Now, nobody's perfect. We sometimes fall into our old habitual patterns, but for the most part, because I've been doing this work for so long, I feel like I live it anymore. It's not just what I do. It's who I am and what I practice in life. So I think one of the big ones is that. And when I treat patients, not being attached to any outcomes, I see that a lot with some of the new therapists that come out. They are so attached to a certain aspect of John's work, like the myofascial unwinding, so that they are oftentimes forcing it or creating it and not letting it be authentic.
Yeah.
And I think if they hear John's words, I was very blessed because I got to train with John. I got all my classes with him and spent a lot of time in his presence and really heard every word. And, mastery is the other thing, is doing this work. And every time you put your hands on your patients, it's as if you're doing it for the first time. Having that curiosity and not letting your arrogance and your ego take over. And I want to share that with some of the new therapists, is surrender and wait for things to happen authentically. Because yes, as important as the structural work is and as profound as the unwinding and the rebounding of John's work is, if we're forcing it, then it's not authentic. And we see that in some of the seminars with some of the maybe newer people. They feel the pressure like, oh, wow, somebody's having a profound major unwinding. Then I must do that in order to be effective. I must do that in order to be a good therapist. But making that happen or making your patients do that when they're not ready or when it's not coming from the subconscious and when they're not taking their own brakes off and going where their subconscious is needing to lead them, then it's not authentic. And I really would like to share that because over the years, I've seen that a lot. And I want the new people to know, just give yourself time when there's trust, when there's safety, when there's love, and patients can feel that they, in their own time, will have their unwindings if they need to go there.
I couldn't have said it better myself. I think unwinding, for those who are unfamiliar, is an involuntary movement. There's a quality to it that's not conscious. And we're never forcing our patients to unwind. So I'm glad you touched on that. You can't force a system that can't be forced, but you can wait with someone. And if you're present and you're centered and you wait with them, you provide a space that allows them to do that if they feel called to do so. And again, I agree. And I'll say that early on, I was one of those therapists where like, man, it's got to be this huge unwinding because it looks so bizarre or whatever it was. And today I can say, hey, it could be a subtle unwinding. We might not even notice it. But when the patient feels that because they're the ones engaging with it, they will often come up and say, man, I didn't move very much at all, but I felt it all on the inside. And they can be just as profound. And something else that you touched on is you were able and you were fortunate enough to take these seminars with John and learn from him directly. And I also am fortunate and blessed to have had that experience. I went to seminars that John taught. And not to say that there's anything bad with any of the other instructors. They're phenomenal. And I still go to seminars now where they're not taught by John. But John has a way of utilizing what I consider the energy. And he does it in a masterful way that allows the experience to be new. And so I would recommend anyone who has the opportunity to take a seminar with John to do so. I know that right now, I think a healing seminar is being taken place in the Sedona area or Camp Verde. And unfortunately, John's not able to teach it. And so I hope everything is okay with you, John. If you hear this podcast, we wish you well, praying for you. But there's something about the way that he's able to make the class its own experience. So the content maybe stays the same, but it's the questions that get answered or asked, and the people who are different that make it a totally different seminar. And then something else you had said was it can take some time to have some patience with it. And I think that that's a normal channel 3 thing. I think us as human beings, we get impatient. And again, it can take some time. It can take some time for you to develop your skills, to open up your practice. And anytime you try to rush that, I think sometimes you get off centered and you maybe make decisions that aren't going to be the most fruitful. Now, I will say, because you touched on it, that, when you can take a lot of seminars, at least early on, because for me, I was just trying to validate whether or not this is real or not. And if you had the opportunity to take it close to where you live, I would say 100% of the time, even if it's a seminar you've taken before, I would take it. And something you shared is, John doesn't like LA, so he hasn't been in that area very often. I was in Austin, or I'm here in Austin, Texas. And I remember my first vacation seminar series, which is 3 seminars back to back. And, there is, I think it was Myofascial 1, unwinding, and then 2. And then a few months later, it was like fascial, pelvis, cervical, thoracic, and rebounding, which is a powerful seminar again. And since then, there have been no seminar series in Austin. So it's like, you kind of think like, hey, this opportunity will exist, but you don't know. And so if you find that you feel pulled in that direction, like there's something that is drawing you to it, take those moments, not just for myofascial release, but also in life, because we have this illusion of permanence. It's like, oh well, it's always going to be there. I'll take it next time. And then it's not until you realize it's not always going to be there that you'll say, I should have done it when I had the chance. So with that, I guess, what are some of those moments for you where you're really glad that you took those opportunities in the moment? Or were there other opportunities where you kind of delayed it and then saw like, oh man, it should have happened. And not to say that it'll never happen, but then that moment you kind of have to wait for it to come up again.
Yeah, I mean, for me, John coming to Pasadena, I mean, I'm so grateful he did come to Pasadena that one year, because who knows, maybe if he hadn't come, I would have never taken his classes. I don't even want to think about that. That puts a lot of fear in me right now. But yeah, opportunities are always around us. They're passing us by. We just have to open our hearts, open our eyes and all of our senses and see them, notice them, and not let them pass us by. Like I said, for me, the training, I took all the classes because I wanted to and I was able to. But since then, I took some other continuing education classes after John's seminar, and one of them was so the opposite of what John was teaching that I actually walked out at the first break. I never completed the course. So, I tried to get other trainings done after that, but it just didn't work for me. But opportunities, and I can't say I really have no regrets. The only thing is I've been wanting to see John, and I've been wanting to take a seminar with him again. And because I have been teaching, all the time that I usually take off is to go away to teach. And so maybe that's one little regret I have now. I would love to see John. I have reached out to, his staff, and I've said anytime, any place, if possible, I would love to visit him and reconnect with him. But I understand he's got a lot going on and is focused on his healing and getting his strength back. But I would like to reach out to John if he is listening, or if he gets to see any of this, that he should reach out to the people who are here for him and who love him and who want to help him grow his work and pass on the knowledge and the legacy of his work. And, maybe he can let us in a little bit more and let us closer in, because I feel like there's no way of us connecting with him, some of us that have not been in the immediate seminars right now. But we're here for you. We love you, John. And I pray for him every day. Every single time I put my hands on my patients, I send love and gratitude and loving energy to John, because every time I do that, I thank him for what he has taught me. It has been an endless, never-ending gift of love and healing, and I'm forever grateful to John for that.
I love that. And I hope that he does hear this. I think we all kind of share the same sentiments. Yeah, without awareness, there's no choice. And so something that he's prompted us to do is to comment in the MFR Insight group, to bring more awareness. I know when I'm taking a course in the world of myofascial release, I'm really active. And then as I embark on, let's say, business things or life challenges, and life is just life, I'll slowly pull away from that. And I know that once I take a seminar again, it'll just come back to me like, how come I get away from this? I like feel so alive. I feel like I'm my best version, but then the day-to-day things creep back in, and then it's a rinse and repeat cycle. So on that note, do you have any advice for me who, I believe in myofascial release, but I find that I can't live it all the time. And it sounds like you've been able to create a life that embodies myofascial release. What would you say to me if you see that I'm like slipping in and out, in and out?
I think it's natural to slip in and out. And as much as I do this and I live it, it's not that I'm in it 100% of the time either. But you know where you need to go. And so maybe give yourself a little bit more importance and priority and say that as much as you give to your patients and to your practice and to your podcasts and all the different areas of your life, also spend some time prioritizing a little bit of that for yourself. I self-treat all the time. My patients ask, "Do you ever meditate?" And I say, all day long as I'm treating patients, I'm in a meditative state. And being present, being centered, not being distracted, that in itself is very healing. So maybe when you're working with your patients, make sure you are fully in that present centered space that allows for love and energy to flow through you, and care for yourself. Go to seminars. I used to go to seminars all the time when I had more time, but in 2019 I got married, and I before that I was traveling a lot overseas, and so life does get in the way, and it's not always the ideal picture, but always coming back and knowing that, oh, this is an integral part of who we are and what we do, and never losing touch with that, I think is important.
I couldn't agree more. And I will say that, we moved away from the healthcare that prioritizes productivity and getting more things done. But I also feel like we live in a society where that's prompted. And so I know when I go, let's say, to a seminar where I can just unplug and just get away from my day to day habits, that I will be able to feel super present and super centered, in addition to when I treat patients. And then it's almost as if when I get back, it's like, instead of prioritizing that feeling, it's like, but these things have to get done, you know? And so one thing that I know that I always get immense value from is just a morning walk. When I wake up in the morning, go out, just go for a quick little walk. And then I always feel good. And then things will pile up. And it's like, okay, well, I got to get this done. And so I think the advice that I could give to not only myself, but anyone else struggling with this is, that work will be never ending. As a business owner, you're always going to have a never ending to do list. But where you really want to prioritize is, who do you feel in the moment? What is it that you want to feel in the moment? And spending some time fostering that, because otherwise life is just going to keep being busy. And I think being still is something that I've learned with myofascial release, that I've really gotten acquainted with, because I understand that life is going to be busy. Everything is going to be moving fast. And so you have to consciously make that effort to be still. And what I've learned for myself is being still is an act of faith, meaning you're not in control, the surrendering that you had talked about. And if you can just trust that, even if it's just for 30 seconds, then you would realize that in that 30 seconds, you're like, I don't have to worry about anything. Everything will resume. But if I just let those things, pull me around, then I will never feel fully present and centered. And like you said, that is a huge healing component of it. I think that's part of why the patient results with myofascial release are so profound, is because we've never been taught to do that, And so when you feel that, when a patient feels that, subconsciously they're allowed to feel safe. They trust you more, even without the words being spoken.
Yeah, on that note, patients oftentimes will say to me, like, "Oh, I just want to stay here forever because I feel so good when I'm here. That can I stay here?" And I always remind them that the way they feel after a session or in a session is all within themselves. We don't create that for them. We're just catalysts. We allow them to access that within themselves. So yes, the environment I have is very healing, very soothing. They walk in through a beautiful garden, and they are in a very safe and nurturing and loving environment. We have, lovely music playing for them. The beds are comfortable, the treatment tables are wonderful, and we give them a lot of love. But the bottom line is, if they don't access that essence within themselves and then they can't feel that within themselves, we really can't give it to them. So I always tell them, remember what this feeling is like and know that it has come from within you and you can reproduce this any other time. And so many of my patients will have a similar setting at home. They will have a room where they have a table, they have all of their self help tools. And when things get hard or when they are in pain, I have taught them what to do and they can reproduce that at home. So that internal, peaceful, loving, intuitive state within us is within all of us. And we can learn, if we're lucky enough, to access it anytime, anywhere, when needed.
100%. Something that John will do in seminars is say, hey, just imagine like this vacation and this setting and remember what that feels like. And for me, that place is Sedona. So I'll be going there with my wife in a couple of weeks here. And I'm looking forward to just unplugging and feeling that again. Now, the last question I want to ask you, because we started with, your journey as a student. Now you've got your own successful myofascial release practice. What advice would you give to someone, let's say, considering physical therapy or myofascial release? What avenue would you recommend that they pursue?
It's funny you should ask this question because one of my patients, one of my younger patients, she's around 30, she did an intensive with me because of her injuries and issues she had. And 2 weeks ago, she asked me, I'm thinking about becoming a therapist. If I do that, will you hire me? She's a mechanical engineer. And so I said to her, what I wanted her to do was to come and volunteer at our office and spend some time really experiencing the depths of what it is we do, because just from her own experience she can't make such a big decision. And she came and she volunteered this week with us and really talked to a lot of patients and heard their stories and witnessed my treatments with some of the other patients and got to see the business end of it. And I think if you're passionate about it, which comes back to the beginning of our conversation, I told her, if you really feel it in your heart and you feel you're passionate about this work, then I will help you find out how to do it. Because to become a physical therapist, you have to go through to many years of schooling. And as we all know, the quickest way to get a license to touch is to become a massage therapist. And being a massage therapist is a little more limiting because you don't have all the knowledge base of PTs, but you still can learn this work and become a great, effective therapist. So I would say, first, identify that this is truly what you want to do and find out the reasons why you want to do it. And if you have all the right reasons, then go for it.
I love that. And I think what I love the most about that is you kind of return to this passion, that you have, and you're encouraging others to pursue their passions. And I think for myself, I would 100% agree with that statement. But I also know that not everybody has that freedom or that privilege to do so. Maybe there's other life circumstances where they have to kind of give part of that away. I do think that that's fearful, because I think if you can generate a living through something you're passionate about, again, just like you said, you'll never feel like you have to work. And I think that is a huge change in life. I think it's one of the freedoms that almost anybody can get if they take those risks. And I think if you can boil it down to what Sefi had shared of like, figure out if this is really for you. Like, you have to know it in your bones, because to become a physical therapist, not only is it very challenging academically, but financially, you're going to incur debt. Or if, hey, you're wanting to become a myofascial release therapist, an easier pathway to that is just becoming a massage therapist. Now, I'm not saying one is better or worse than the other. It's just two different avenues. And for you and myself, I love being a physical therapist. I know that the background that I've gotten from that helps me feel more grounded in this work. And I know that since John is a physical therapist, that also created a level of resonance where I was able to trust him a little bit more because I had known what he had gone through. And so for anyone, I think that is just such good advice and wisdom. It's like, hey, stop all the noise. Everyone's going to be telling you what you should or shouldn't be doing. But ultimately, you have to figure that out for yourself. And if you make that decision based on your own passions, based on the way that you feel and the drive that you have for that, then it'll work out. But if you are starting to do things based on what other people say, you're gonna lose that part of you, and that's something that we do in every facet of life. And so if you can just remember, hey, what am I really doing this for? Is it for me and for my patients and the ultimate life goal that I have? Then it'll be worth it. That doesn't mean there's not going to be any challenges. That doesn't mean that there's not going to be any obstacles, but it will be worth it in the end because you did it for a reason that is really meaningful for you.
Yeah. And believing in yourself, I think one of the things that has always helped me in life, ever since I was a little kid, my father told us, I have two sisters and a brother. My father said, there's nothing you can't accomplish if you don't put your mind and your heart into. And so I have lived all my life following that advice. And when I started physical therapy school, before I started physical therapy school, I had to take so many units in order to be able to apply that year for the PT program. And I found a way because I was so determined to do it. They said you can only take 15 units at Cal State Northridge, where I was going to college, and I needed 21 units to be able to finish everything and apply that year. And so I got special consideration from counseling to allow me to take 18 units at CSUN. And then I took 3 more units at another junior college so that I could complete my 21 units. But if you're focused, if you're driven, if you really want to do what it is you really want to accomplish, there's always a way. And yes, like you said, there may be challenges. It may be really hard, but it is possible. And so find out what you love, what makes you happy, and face the challenges, because even with healing, sometimes it gets messy. We have healing crises, we have therapeutic pain and therapeutic soreness. It's not always fun and games. It's ups and downs. And as long as we're willing to face the highs and lows, then we will come out stronger on the other side.
I couldn't have said that any better. I think that is so wise, and it's not the absence and avoiding the challenges. It's facing both the highs and the lows. So I love the way that you said that. I just want to thank you for being so open and honest with us on this podcast. I know I gleaned a lot of wisdom and just reminders about following your passions, choosing your own life that you want and then building around that. And then also like having to get out of the rat race of healthcare, finding myofascial release. I just want to thank you for sharing all of the wisdom that you gleaned from your own life. Before we get out of here, is there any last thing that you would like to share with my audience?
Well, I first want to thank you for doing this. I'm so not into the world of social media and, all the technical advances of, technology, but I appreciate you doing this and I appreciate you reaching out. But is there anything I want to say to your audience? Well, follow your love and passion and help others and really educate. I think the education is where the key is. And I have now reached a place in my life with all the experience that I have, decades of work and experience, that I want to educate the public. I want to educate the medical community. I want to educate patients, people. So find your purpose and spread the knowledge, spread the word, because we need more people to know about this work, the power of this work, how it can change lives. And if all of us can find a way to get together and pull our power together and do this, I think John many years ago said that, we are the pioneers of this work. I wrote him a text in one of the messages yesterday. 25 years ago, he said, we are the pioneers and this is going to be the future of healthcare. And I feel like now we are in the future. This is the future, and all of us should do our part in spreading the knowledge, spreading the work, and getting more people to know about it, because it's going to change lives.
I love that. Thank you so much.
You're welcome. Thank you.
Thanks for listening to another episode of Myofascial Health. I help myofascial release therapists create beautiful websites for their MFR practices, even if they aren't tech savvy. If you're just starting your MFR practice, or you're an experienced MFR practice owner, learn more about how I can help at www.myofascial.health/website.